Greetings all, and welcome back to Simple Living Happy Home. I've done quite a few just general lifestyle videos recently, and today I want to kind of take a turn into more of my professional realm and talk about lymphedema. In order to understand what lymphedema is, you really need to have a little bit of information about the heart and the kidneys. So the heart pumps blood through progressively smaller vessels called arteries, all the way down to your capillary beds. At your capillary beds, these vessels are so small they only allow one red blood cell to pass through at a time. Because of how small they are, all of the fluid that's typically in your bloodstream gets squeezed out into the tissues. As you move through the capillary beds and get to the vein side of them, 99% of that fluid is picked back up by the vein side and moved back to the heart. But there's 1% of that fluid that's still left in the tissues. And that is what your lymphatic system is there to take care of. The lymphatic system runs parallel to the bloodstream. And so everywhere there's a capillary bed, there's going to be the lymphatic system there to pick up that 1% of fluid that's left. It gets moved then through the lymphatic vessels to the lymph nodes and gets processed kind of like a recycling center. It gets broken down a little bit, but then eventually it gets dumped back into the bloodstream for the kidneys to then filter out that extra fluid and those extra things that your body doesn't need. And then it gets excreted from your body through the bladder by urinating. Now, the word lymphedema is made up of two components, lymph and edema. Lymph obviously referring to the lymphatic system, and edema referring to swelling. True lymphedema is swelling caused by injury or inadequate function of the lymphatic system itself. But you can have swelling without there being anything actually wrong with your lymphatic system. For instance, if you injure yourself somehow, say you sprain your ankle, you end up with swelling because there's an overload of fluid there that your lymphatic system just isn't able to handle all at once. Some other things that can cause swelling without there being anything wrong with your lymphatic system are if you have a heart issue, if you have kidney problems, if you're pregnant, if you eat too much salt, and if you're just very inactive. No matter if you have true lymphedema or if you have swelling due to some other secondary cause, the treatment is largely the same. Treatment from the medical side will usually start with water pills or Lasix. From the therapy side, if you're working with a lymphedema certified therapist, which I am, what you'll end up starting with is manual lymph drainage, which is a special type of massage, and wrapping with short stretch bandages. Both of these are designed to help bring your swelling down, and then after your limb has reached a close to normal size, or at least a stable size, will transition you into some sort of long-term compression, like a compression sock or maybe even Velcro wraps. One of the treatments that's typically only used for true lymphedema are lymphatic compression pumps. These basically are a sleeve that you would slide over your leg or your arm or whatever body part, and then it hooks up to a machine that will pump air into cells in that sleeve around your limb and gradually push fluid from the far end of your limb up towards your heart. As a lymphedema certified therapist, there are some things that I have to watch for and be cautious of when I'm working with somebody who's dealing with swelling. First of all, I need to watch for any signs of infection. Because the lymphatic system moves fluid from one body area to another, I have to be careful that I'm not going to be moving fluid that may have some sort of an infection to another body area and causing that infection to spread. This can become something like cellulitis, Or worst case scenario, it gets into your bloodstream and becomes septicemia. Along with that, another thing that I'll watch for is if someone's on antibiotics or if they have an active infection. In cases like that, my rule of thumb is that someone needs to be on those antibiotics for 72 hours and be showing visible signs of improvement in the infection. The reason why they need to show those visible signs of improvement is that's what tells me that they're on the right antibiotic to treat the infection. If we aren't seeing any improvements in the infection itself, that needs to be communicated back to the doctor because you may not be on the right antibiotic. Because the lymphatic system is going to be moving that fluid back into the bloodstream, it's going to tax the heart. If there's already issues with the heart, increasing the amount of blood that it has to pump can progress those heart issues. So in a situation like that, I contact the doctor to explain what I'll be doing and what effect it will have, and then they communicate back to me on if they feel that the heart is stable enough to be able to handle moving the fluid. The other organ system I have to be very aware of are the kidneys. Since the kidneys are going to be responsible for filtering that extra fluid and getting rid of it, I need to make sure that the kidneys are actually functioning well enough to be able to do so. So again, that requires communication back to the doctor on what is the status of the patient's kidneys. If somebody is on dialysis, it means their kidneys function so poorly that they have to go into a clinic and have a machine filter and clean their blood. In those situations, I still need to contact the doctor and usually the dialysis clinic to let them know what I'm doing so they can adjust how much fluid they pull when the patient goes to dialysis. Another thing that I'll be watching for closely is if there's any signs of wounds or skin breakdown. When you have a buildup of excess fluid, it creates a larger distance between the skin and the bloodstream underneath. The bloodstream is how the skin gets the vast majority of its nutrients. It's not from external things like lotion. When there's too much distance between those two things because of swelling, it makes it harder for the skin to stay healthy, and you can end up with wounds and open sores much easier. I've even worked with multiple folks who have so much swelling that it actually starts to leak out of their skin, and what we call weeping, which basically creates an avenue for bacteria to get in underneath the skin and cause a skin infection called cellulitis. If a patient is dealing with weeping or if they have any wounds, they become a little bit more complicated because they need a combination of wound care, swelling management, and close supervision of their body area to make sure they don't end up with an infection. When I start working with somebody in clinic, a lot of the time I will hear from them, I've had compression before and I don't like it. After some experience, I've learned to ask a couple follow-up questions. Where did you get them? What level of compression were they? Did someone measure you for them? If they did, who was it? I have found that 99% of the patients I see, it's not an issue that they don't like compression, it's that they never had compression that fit them correctly. The three primary things to watch for when fitting someone for compression garments are the correct size. Compression garments are not made to be one size fits all, and they're designed to provide a particular level of compression based on the limb size. If you're wearing a garment that's too small, it's going to end up providing a higher level of compression, and because of how the garments are made, that level of compression may not be even across the entire garment, which means you could end up with what we call a tourniquet, or the garment kind of biting in on your leg or your arm or wherever it happens to be. The other thing I watch for is the compression level. Compression socks in particular can have a wide variety of compression levels that they are designed to apply, and they are graded based on millimeters of mercury. So some of the most common ones are 15 to 20, 20 to 30, 30 to 40. If you're wearing a garment that is rated to provide a higher level of compression than what you need, it can be uncomfortable. The third thing that I watch for is the patient's limb shape. Not everybody is going to fit into the standard size and shape of a compression sock. If your leg shape is significantly different than the standard, most compression socks are going to bite in on certain parts of your limb and be uncomfortable, even if you've been measured and it would be the correct size for you. A course of treatment will usually start with manual lymph drainage and wrapping with short stretch bandages. The short stretch bandages are intended to decrease the limb size and to be worn 24/7 between therapy sessions. Typically, how I work this with my patients is that when they come in to see me, I will take the wraps off and I will do a leg bath and cleanse their skin and put some deep moisturizer on before I reapply the wraps. Something else that I've done with patients in the past is we coordinate them taking their wraps off at home and showering about 2 to 3 hours before I would see them for their therapy session. So that way they're not out of the wraps for very long, allowing their limb to swell back up again. The wraps get worn an average of about 4 to 6 weeks, but depending on the person, I've gone as short as 2 weeks and as long as 12. Once the limb size has become stable, I measure for that long-term compression garment. And there's multiple options for compression. One of the options for long-term management is prefabricated, non-medical grade. These are going to be what you would typically find at Walmart or you would buy on Amazon. These will usually have a suggested compression level, but they're not tested and verified to provide that. The next option is a TED sock. This is typically what patients think of when they think of a compression sock. TED socks are anti-embolism socks, not gradient compression socks. Anti-embolism means that they are designed to prevent you from having a blood clot in your leg. Now, the stipulation with this is that these are only designed and tested to prevent blood clots when the patient is in bed. If the patient is going to be getting up, that they should be transitioning to some sort of gradient compression sock. But you will still see surgeons all over the country prescribing TED socks to be worn 23 hours a day after surgery. The reason why they choose TED socks is because, one, they're cheap compared to gradient compression socks. Two is that they're very easy to select a size. And three, insurance typically covers TED socks. However, the biggest downside with TED socks is that they rarely fit patients, and they will frequently cause some sort of a tourniquet somewhere along the leg. The next step are gradient compression socks. These are medical grade and are tested to provide the level of compression that the company advertises. There are specific brands that will make actual gradient compression socks, and two of the best that I have used in the past are Jobst, Jobst, and Sigvaris. Gradient compression garments are the ones that need to be measured correctly in order for them to fit you properly. These are also the ones where the correct compression level needs to be decided in order to provide the right level of compression that you need and not going too high or too low. These are typically what you will see as long-term compression. The next option are Ferro or Velcro wraps. These are the next step up from gradient compression socks because as the compression level goes up, gradient compression socks become more and more difficult to put on. So a Ferro wrap is a nice compromise because it has Velcro straps that are easier to apply versus trying to pull a very tight sock over your leg. Ferro wraps typically provide compression in different pieces. So there may be a foot piece, a calf piece, a knee piece, and a thigh piece. These are generally more expensive than the gradient compression socks, but as I said, they're easier to put on and they can provide higher levels of compression for those who need a lot of support. Most patients that I work with don't need ferrule wraps, but there are many that I have measured and ordered these for. The final group are custom compression garments. Both gradient compression socks and ferrule wraps can be custom made. Custom garments require a lot of specific measurements, and each company will typically provide a measuring guide for the therapist to follow to ensure that we are measuring from the right landmarks. Typically, insurance will cover custom garments. However, how many they'll cover each year is variable by the insurance. Some folks that might require a custom garment are going to be those that may have an unusual limb shape or size because of true lymphedema or elephantiasis. True lymphedema may end up with lobes of skin that need special garments to be made to provide support and compression correctly to those body areas. The final long-term treatment option is lymphedema pump. These can be used in clinic in conjunction with the manual lymph drainage and short stretch wraps, as well as ordering them for patient use at home. Those patients who have severe lymphedema or elephantiasis may require having a compression pump at home to be able to use on a daily basis. One thing to note on these is that they will actually move lymph fluid through the body faster than what the lymphatic system normally would. For someone who has heart or kidney issues, as the therapist, I need to be very cautious about using one of these because it can increase that tax on those two organ systems much faster. Outside of compression garments, some things that you can include in your daily life to help manage swelling are going to be exercise, walking, biking, swimming, anything where you're getting the body moving stimulates the lymphatic system. The lymphatic system doesn't have a pump incorporated into it like the heart within your circulatory system. So the pump that it has to rely on is the movements and the muscle contractions that you do when you are doing exercise and normal daily movements. When it comes to exercise, getting a skin stretch or using your joints to their full range of motion really helps to stimulate the lymphatic system as well. The second thing you can do is to elevate your body part above your heart. Gravity will always be looking to push fluid down to the lowest part of you possible. By getting your limb elevated for even 20 to 30 minutes a day helps to counteract some of those effects of gravity. And the third thing you can do is dry brushing or a self-lymphatic massage. There are a lot of tutorials on how to do dry brushing and self-massage, and I plan on doing my own tutorial here on my video and also including some specific exercises geared towards addressing the lymphatic system. Just be aware that a lymphatic system can start to be a little sluggish even if you don't have true lymphedema and you've just had a recent illness or have been inactive for a period of time. Well, that's going to be all for today. As I mentioned, don't forget to come back for the tutorial on self-massage and specific lymphatic exercises. While you're here, like and subscribe so you don't miss on anything to come. I'll see you soon.